Great. So once again, thank you so much, Erin, for having me here. As Erin said, my name is Sean McNally. I'm a board-certified music therapist at Memorial Sloan Kettering Cancer Center. I'm a research music therapist working on the MELODY study. I'll tell you all about that in the latter portion of the presentation today. But thank you for being here. I really appreciate your time. And without further ado, I'll jump into it here. If you have any questions, feel free to type them in the chat and I'll get to them at the end. We'll have plenty of time for that. So here we go. Okay, so just a little overview. Today we're going to talk about the definition of music therapy. From there, we'll kind of go into what really is music therapy, kind of talk about some common goals within music therapy sessions. We'll talk about the kinds of settings that you might typically find this type of work. Then we'll take a little bit of a closer look at two different methods of music therapy, 2 out of the 4. I'll talk a little bit about that. Then we will dive into a little bit of the virtual aspects of music therapy. I know this kind of ever-changing world with COVID, things are turning out to be on the computer, kind of like this presentation. So we'll talk a little bit about how that affects music therapy. And then we will have a little discussion prompt, just a short one. Feel free to engage in that or not engage. It's totally up to you. I can guide that a little bit. And then we will talk a little more about music therapy in cancer care, kind of specific goals related to this particular population that I work with and that many of you, I'm sure, are a part of as well. From there, we will do a short music-guided experiential. We'll talk a little more about that when we get there. And then I'll give you an overview of the MELODY study, which is really most of the work that I'm doing these days. Then we'll close with a little Q&A for any questions that might come up. So here we go. Off the bat, this is the definition of music therapy. So the clinical and evidence-based use of music interventions to accomplish individualized goals within a therapeutic relationship by a credentialed professional who has completed an approved music therapy program. That's from the American Music Therapy Association. That can be found on their website there, musictherapy.org. This is really just kind of the all-encompassing definition to kind of hit all the points in as succinct a phrase as we could possibly come up with. It kind of touches on the nature of the work that we're doing, the kinds of things we're doing in the work, the kinds of people that are doing that work, and the level of training that you need to go through to be able to do that. So that's kind of just an overview of the definition. So where does music therapy happen? What kind of places? This is just a list of the different settings that you might find it in. So that could be in hospitals, whether it's in the hospital or we also have outpatient programs. Sloan is actually working on launching theirs very soon in the next month or two. You can also find music therapy in adult care facilities, whether that's memory care or working with patients with dementia. Hospice and palliative care is also a very prevalent area of the field. A lot of like life review, comfort for the patients and the caregivers in that end of life period of time. You could also find music therapy in child care facilities, working with whether that's special education, developmental kind of modalities, or even just play and creative modalities as well. Those can also be related. You could also find music therapy in mental health care facilities. So whether that's psychiatric facilities or even like mental day health facilities, people could come to receive those services as well. One of my internships was actually at a day mental health facility in Harlem. You could also find music therapy in schools. So it really runs across the gamut. Sometimes music therapists can work in more of like a guidance counselor kind of role. It can work more in a music teacher kind of role, a community building kind of role. The field can really fit into wherever the setting needs it to, if that makes sense. You could also find it in community centers, as well as correctional facilities like prisons and places like that, as well as private practice. So just like you could seek out a therapist, you could also seek out a music therapist. They're out there. Their insurances don't necessarily cover them all, but they're getting better at it. So that's generally the most common places that you might find it. So what really is it though? Like, what does it look like? What happens in the sessions? So I'll talk a little bit about that. So the biggest point I want to make here is that you don't need any music training to participate in music therapy. It's really all about the experience of being in the music. It's a very integrative experience. We do talk in music therapy. It's not just music. We do talk about music. We music about music, but there's definitely a large talking component. That's a common misconception that it's only music. There is a talking component to it. So to break it down, everything that we do in music therapy sessions could be broken down into 4 different methods. So those methods are receptive, recreative, compositional, and improvisational. So in that order, receptive is kind of the music listening aspect of things. So kind of receiving music via the ear. That's how you hear. Recreative is kind of making music that exists already, like recreating it. Compositional would be writing music. So that could be writing poetry, putting music to that poetry, even taking songs that exist already and writing new lyrics to it. We call that a song parody. And then improvisational is really making it up on the spot. It really gets to that spontaneous, creative side of the brain. That neuroplasticity plays a big role in that. So at the bottom there, the song sharing, analysis of lyrics, those are kind of different interventions that fall into different methods. So like a song share would be a receptive method. An analysis of lyrics would be a receptive method. A life review could really fall into, I mean, you could write a song about one's life. That could be a compositional method. Relaxation kind of goes across all 4 of those methods. Creative expression also kind of goes across all 4 of those methods, as well as emotional release. So that's a general gist to kind of put our toe in the water in that, so to speak. So as for goals, so like what can music therapy really achieve for patients? It really comes down to encouraging like a creative space to play music, to just play in general. From that, you can really find some symptom management, some symptom relief. There's a lot of psychosocial goals that you can address that can all be achieved via music. So you can see them on the screen here. I don't know if everybody has video capability, so I'll just read these out. You can reach some symptom relief for pain, anxiety, depression, fatigue. Goals from the psychosocial side of things, music therapy could address isolation needs, social support and meaning, spiritual support and meaning. So really addressing that spiritual side of things, like gospel music is a big part of where that can play a role in sessions, as well as music and music therapy can really bring a family bonding and communication aspect to sessions. And the biggest part of this really like that creative, getting into that creative space, that play space. It can facilitate movement. It really getting into that wellness side of things brings with it the symptom relief and the psychosocial needs as well. So to kind of talk a little bit more about what kinds of music happen in these sessions, it really all depends on the person. There's no right or wrong way to go about it. It could be this way, it could be that way. Like there's no one answer to this question. Essentially, it could be listening to music, it could be playing music, It could be music that you know already. It could be new music that you've never heard before. It could be instrumental music, as in without any words or voice. It could be vocal music with only voice. Again, just to reiterate, there's a verbal processing aspect of the interventions that really cements the interventions in a different part of the brain. Like, it's one thing to listen to a song and then not say anything about it, but then it's another thing to listen to a song and then share with someone about what you thought of that song. And then the music could be live, as in played in the session by the therapist and the client, or just by the client, or just by the therapist. Or it could also be recorded music, so on the computer or a record or a CD. So there's really any music you can think of can be used in a music therapy session. So I'll talk a little bit more about receptive interventions. So that's really like the listening components of music therapy. Again, the verbal processing is a huge part of this to really integrate that music experience into other parts of the brain. So one receptive intervention that we use is called music listening. So that could support in times when comfort and relaxation are needed. It could be chosen by the therapist. It could be chosen by the client. It's really just providing a space to explore whatever wants to be explored by the client or the patient. So that's kind of like the first step into music therapy sessions. It's like, what kind of song do you want to listen to, and what does it mean to you, and things like that. And then another receptive intervention would be something called a music guided relaxation. There's plenty of names, a lot of different names to it. It could be a music guided deep breathing, a music guided humming experience, a music guided visualization. Really, relaxation is like the biggest catch-all for the ultimate goal of this type of intervention. So in a music guided relaxation, the music could be live, played by the therapist, or it could be recorded. There could be a kind of guidance by the therapist, kind of talking you through the process, sort of like a body awareness, a progressive muscle relaxation, like bring awareness to your breath, things like that. It could really create this meditative experience and space to kind of slow things down, bring that extra restful, that bit of rest in the middle of the day or towards the end of the day, just that little 5-minute break that sometimes we all need to take, myself included. So those are some receptive interventions. Now, to talk about kind of the next step of it would be more active music making interventions. So instead of listening, this is more about kind of playing the music, or engaging in the music. So singing and humming are a great way to kind of take that first step into recreative interventions. Again, they can support comfort and relaxation. That's kind of like across the board for a lot of music therapy. That's a major goal. It could be chosen by the client or the therapist. When it comes to humming, that's a very like inward yet expressive type of intervention. It brings body awareness. It can kind of turn the mind off to really focus on the physical sensation of humming. Whereas singing is a more outward expression as opposed to the inward expression of humming. There's really no right or wrong way to go about it. I'm sure some of us have sang a song and just felt a little bit better afterwards. So it's really like attaching on to that feeling of like, man, I just sang that and that feels great. And I expressed myself through this song that I love. So there's a lot of therapeutic benefit to singing and humming. And then rhythmic improvisation, excuse me, essentially that's like a good step or a good starting point to improvising music, because you don't need a lot of musical experience to improvise rhythmically. We've all done it, whether we're tapping our foot or snapping our fingers or even dancing. There's some rhythm improv to that. It really supports creativity, fosters that spontaneous nature. There's no right or wrong way to do it. it's really all about exploring the musical experience, getting into that state of play, and just having some fun, making it up, just going for it, so to speak. So those are some recreative, active music making interventions. There's plenty of them, but those are just two examples. So, excuse me, considering that the world we're in now with this, whether we're still in COVID-19 or post-COVID-19, however you want to think about that, it's really changed the face of how we receive mental health care services. Generally, in the past, music therapy has been in person, like in a room. There was telehealth music therapy, but it wasn't as prevalent as it is now, post 2020. So just to talk a little bit about that, I'll give you my initial thoughts on prior to COVID, and then I'll kind of talk about where things are now. Prior to COVID, personally, I would say that you need to have music therapy in the same room. I have changed my mind on that, and I'll tell you why in a little bit. But music, in my previous thought process, is that music in the same room is just the only way and the best way, and you have to be able to receive those sonic waves from the instruments and from the voice. There's just a quality to that. There continues to be a quality to that, but kind of the virtual aspects of all this have really opened up a whole new set of benefits. Essentially, the access to services is much more accessible now with kind of with not the invention, but the implementation of mental health care services via the computer, via a tablet. You could take sessions on your phone. They're much more accessible. You can say that, let's say that you live in a rural area and you can't really make it to a music therapy session that's an hour away or a half hour away, or even 15 minutes down the road. It's just too much of a process to get there. You could just pop your phone out of your pocket, get right on the session. So the access to these services are much more accessible, which is a great thing. There is a thing called latency, or like a delay. It happens on the phone. It happens on the computer. You can't really play music live with a person. There's like a half a second delay. But there are ways to kind of get around that, especially in Zoom. Zoom, the platform that we're on right now, has been great in making it easier to, or as close as possible to playing music with another person in the Zoom. There's barely any delay. So they've been a great asset to these types of interventions. And then kind of considering COVID, the social distance that you have kind of via a computer, you have less exposure to COVID. You don't have to leave your home. You don't have to travel, but you could still kind of fight that isolation of being alone or with a very small number of people in your home. Research has proven that it works. It's convenient. You can take those sessions from home. There's a great amount of benefits. So my mind has been changed on how virtual music therapy can be implemented. I used to think it couldn't work. I've been proven completely wrong. It works immensely. I've seen it happen. There's a ton of benefit to it. So I just wanted to share that with you. So I'll take a little breather here. I'm a little curious from you guys and gals and people, everyone here. Is there a song, and feel free to type it in the chat, or I'd say type it in the chat is probably the safest way to go about this, but is there a song that brings you joy or comfort? I'd be happy to share as well if people are feeling a little shy today. I know that Lovely Day by Bill Withers just brings me joy every time I hear it, no matter where I am. It lightens up my day, no matter what. So does anyone have a song that might be joyful or bring them a little comfort? And it's okay if not. I know I'm doing a lot of talking here, so I want to make sure there's space for everyone else as well. Here Comes the Sun That's a great song. So much joy in that song, especially on a cloudy day like this. That's a wonderful one. I'll keep rolling here, though I'll leave a little space if anyone's still thinking of a song that might bring them some joy or comfort. That's all right. I'll roll on. Here we go. Oh, okay. Beyond the Sea. We have a few coming in. Ave Maria, Amazing Grace. Pacho Bell, I'm probably saying that incorrectly. That's wonderful. Such an eclectic taste from everyone. Like, music speaks to people in so many different ways. It's a beautiful thing. I appreciate you guys reaching out, putting that in the chat. Sorry, I appreciate everyone putting that in the chat. Great. Okay, I'm gonna roll on here. So let's see. Oh, you can probably see that on my screen. I apologize. Why is this not moving? There we go. Okay. So now I'm going to talk a little bit about music therapy, specifically in cancer care. At Memorial Sloan Kettering, music therapy is within the integrative medicine service. So integrative oncology is a patient-centered field that uses evidence-informed modalities from different healing traditions alongside conventional cancer treatments to optimize health. So those different modalities are dance, fitness, massage, meditation and yoga, acupuncture, as well as music therapy. The three kind of overarching themes that we try to address within our department is lifestyle modification, body-mind practices, as well as natural products. We have a Chinese medicine department right now, or not department, but there's a Chinese medicine team in our service that kind of prescribes different herbal products that aren't necessarily pharmacological, but they're more holistic. It's a great program. I highly recommend checking it out if you're interested in that kind of thing. And also music therapy has been recommended in the clinical guidelines of leading cancer organizations such as the American Society of Clinical Oncology, the National Comprehensive Cancer Network, and the Society for Integrative Oncology, which are three organizations that we put a lot of research into. SIO, we put papers in there every year. They're all great organizations. So as for some common music therapy areas of focus in cancer care, or like goals, they're listed here on the screen. And working on anxiety, coping, depression, processing, self-expression, and spirituality. It's really all about providing a space for patients and caregivers to receive some symptom relief, trying to connect to those parts of the self as resources. It's like finding where that inner resource is and highlighting it and kind of bringing it out to fruition, while recognizing strengths that people have within them. I know that can be hard throughout cancer care, so we try our best to highlight those with individuals in those spaces. Provide as much support as we can, whether that's during treatment or whether that's after treatment, which is kind of what the Melody study is all about. So with that, I'd like to try a music guided deep breathing exercise. Feel free to participate. If you don't want to participate, that's okay. You can engage at whatever level you feel comfortable. This is really only going to take about 5 minutes. Essentially, I'll play some guitar. I believe I need to click a certain button that I'm not sure if I did. Let's see. I need to turn on original audio for myself. I apologize for the delay here. Oh, clicking too many things. Where might it be? Stand by for technical difficulties. I'm going to stop sharing my screen for just a moment here to click this button, and then I'll come right back to it. Okay. Great. Is my screen still, can you guys see my screen again?
Oh. You're good.
Okay, great. Thank you. So I'm going to play a little guitar. This will be about 5 minutes. And it's really all about kind of bringing focus to the breath. So feel free to engage at whatever level you feel comfortable. Can I just get a confirmation that this guitar is coming through?
Yes.
Awesome. Thank you. So beautiful. Thumbs up. Much appreciated. So this will be about 5 minutes. I'll play some guitar, and here we go. So this is a music-guided deep breathing exercise to kind of bring a little focus to the day. Maybe take a little break for the next 5 minutes or so. And I ask you to just take a few deep breaths with me to start off. If you feel comfortable, you can close your eyes. If you don't feel comfortable closing your eyes, you can take a downward gaze towards the floor to relax your forehead. As you do that, feel the support of the chair that you're sitting in. With your feet on the floor, whatever comfortable position that you're sitting in. And just bring attention to your breath. Without trying to change it, but just attending to it. Feeling how you breathe in and how you breathe out. Perhaps you can feel the rising and falling of your chest. Perhaps you can feel the air touch your nostrils. And as we listen to the music, let it take it where you want to go. You can focus on your breath or drift off to wherever you feel most comfortable. music comes to an end, take a few moments to bring your attention back to the room. There's no rush at all. Know that you can always go back to this place. So, any thoughts on that experience? Generally go deep into the processing of that within a session, but just wanted to take a few moments to maybe think about that to oneself. We could probably talk about that a little bit in the Q&A, but I appreciate everyone going there with me on that little journey. So that is a music-guided deep breathing. So we'll keep on rolling here. I hope that was a nice 5 minutes for everyone. But we're gonna keep going. Got plenty to get to. So, in that first half, I talked about music therapy kind of as a whole. Now I'm going to get a little more specific and tell you about the Melody study over at Memorial Sloan Kettering. This is really the majority of the work that I do right now. So this is a research study out of the Integrative Medicine Service at MSK. So the Melody study is comparing music therapy versus cognitive behavioral therapy for cancer-related anxiety in cancer survivors, and it's all via telehealth. So the three big things that, let me see if I can move this. The three big things that we are addressing in the Melody study, they were really highlighted by the pandemic, was mental well-being. Everybody had an interesting, to say the least, time of the last few years. Access to services was difficult to achieve with social distancing and everything that came with that. So telemedicine became very prevalent within society, as well as health equity. So people's access to healthcare services, it wasn't really uniform across the board, so we were trying to address that as well. And that all, I'm having a little, there we go. The Melody study is trying to address all three of those things throughout the research. So, just a few factoids that kind of guide the research. 1 in 3 cancer survivors suffers from clinically significant anxiety symptoms. And more than half, or 64% of cancer survivors take 5 or more medications, which underscores the need for non-pharmacological treatments for anxiety, as in non-drug related, non-pill related, non-invasive injection related. It's all just music therapy or CBT, so therapy related interventions. So CBT, if one goes to a doctor and says, I have anxiety, or if a doctor says you have anxiety, if you don't want to take anxiety medications, the first line of treatment would be cognitive behavioral therapy. That's been proven time and time again that it works. So that's generally what you're going to get if you go to a doctor. Music therapy is also proven effective. It's been recommended by the ASCO and the NCCN guidelines for anxiety in cancer survivors, as I talked about before. So we're comparing these two types of treatment to treat anxiety for cancer survivors. Everything over Zoom, so telehealth sessions, and essentially we're trying to figure out which is more effective, like which type of treatment is effective for which type of person. Do some people like CBT more? Do some people like music therapy more? And why is that? Like what factors factor into those types of kind of personal differences, if that makes sense. It's like, oh, I really want this type of treatment, or I really want that type of treatment, and what are those factors that make you want that? So I keep moving this bar all over the place. So the MELODY study is a 2-arm parallel group randomized comparative effectiveness trial. So the 2 arms are music therapy and cognitive behavioral therapy. Essentially, when participants come onto the study, they fill out a baseline survey at week 0, kind of asking about anxiety and comorbid symptoms like fatigue, sleep disturbance, things like that. Once they fill out those surveys, they're randomized to a group. So that's either a music therapy group or a cognitive behavioral therapy group. They receive 7 weekly sessions. Those sessions are about 1 hour long. They're one-on-one with a therapist, and they take place online over Zoom. Once those 7 sessions are completed, participants enter a follow-up period, and they fill out surveys at weeks 8, 16, and 26. There's also a halfway survey, I forgot to mention, at week 4. So 1, 2, 3, 4, 5 different surveys throughout the 26-week treatment. But throughout the 26-week study, but the treatments are only 7 weekly sessions up front. That's the big time commitment. And then, so like I said before, 7 sessions. They're about an hour long. They're once a week. Everything's online over Zoom. And then in addition to those sessions, there are home practices that happen between the sessions. So kind of like, I don't want to say worksheets because they're not really worksheets. They're more like, we call them home practices because we don't want you to think that they're homework. They're more like guidelines of things to think about between sessions, whether that's cementing ideas in the previous session or opening up ideas for things that are going to be covered in the next session. They take about no more than 30 minutes in between the sessions. So then we're enrolling 300 participants with any cancer type or stage who've experienced anxiety symptoms for at least 1 month. They need to be English or Spanish speaking, 18 years or older, any cancer diagnosis. They need to be free of oncological disease or NED. We also have some other ways of kind of moving people into the study if things are close enough to NED. They have to be reporting anxiety symptoms for at least 1 month, as well as willing to adhere to all study procedures, as in like the willingness to participate in either music therapy or cognitive behavioral therapy. It's a 50-50 chance that the computer kind of randomizes individuals to. And they also need access to Zoom in a quiet, private location. The exclusionary criteria is in criteria that would exclude people from being able to participate, unfortunately. We are unable to take participants that are either on active treatment or less than 1 month. Either they're on active treatment or have had active treatment within the 1 month of enrollment. And then they also could not have received 7 or more music therapy or CBT sessions specifically for anxiety within the last 6 months. Related to that treatment, hormonal and targeted therapies are allowed on the study. So just wanted to put this here. If you or anyone you know has completed cancer treatment, whether that's chemo, radiation, surgery, or a transplant, and have been experiencing anxiety for at least 1 month, you may be eligible for the study. It's totally free. At this time, we're only enrolling participants in New York, New Jersey, and Connecticut. I do have the contact info here in this slide. That's the phone number you could reach out to, or you could shoot us an email at medmelodystudy1. That's MEDMELODYSTUDY1 at mskcc.org. We check that email pretty constantly throughout the day. So that's the contact info for that. Just wanted to provide a few additional resources. In case you're curious about more information about music therapy, you could always go to the American Music Therapy Association's website at www.musictherapy.org. If you're curious about the MSK Integrative Medicine Service, the website there is mskcc.org/integrative medicine. And then if you want a little more specified, kind of like accessible information, we have a page with a lot of content with guided meditations, a lot of videos, a lot of audio tracks on the Integrative Medicine website, and that's at mskcc.org/meditation. So those are just some resources I figured I'd put up there in case anyone wanted to access any of that. And with that, I'd like to thank you all very much for listening to me talk about music therapy and the melody study today. So that's all I have for you. Much appreciated. And